you've made the diagnosis, you've tried to find out their triggers, you try and change their lifestyle. How do you treat the active headache?
With the active headache itself, by far the most effective medicine on the market today is what are known as the triptans, and there's like 7, 8 of them. And they all work probably about as well as one another, although people respond maybe better to one than the other. What you need to do, if it is a migraine, you need to treat that migraine as early in the course of the headache as possible, because there's what we call central sensitization.
Central sensitization, what's
yes.
that?
And what that is, and when people get a migraine, within maybe half an hour or an hour, their skin becomes very sensitive. They touch the top of their head and it starts to hurt. Their neck, you touch it and it starts to hurt. That's what we also call allodynia. And when allodynia sets in, that usually means the triptans aren't going to work very well. So for people that have waited for like an hour or two and say, I'm just going to work through it, I don't want to take this medicine, if they've developed this allodynia, triptan's not going to do anything. At that point, we think it's probably prostaglandin released. That's why there's one medicine on the market that has a combination of naproxen and a triptan in order to try to treat it, to try to catch it in time before you get the central sensitization.
In general, are these triptans prescription only, I take it, but
yes.
Are they pretty effective if you can get it within the first 42 minutes of the headache?
Probably 60% of people, it will work, but it doesn't work in everyone. And that's why migraine still remains a frustrating condition to treat. But then there's other modalities. Most people know that if they go to sleep, that if they can get some sleep when they wake up, the headache is usually going to be gone. But a lot of people, if the headache is that bad and they can't get to sleep. So, but the triptans is clearly the treatment. And if people are having frequent headaches, so they need to be on daily treatment to try to prevent them.
What is the preventive treatment? Or you said daily headaches. What if somebody's having 8 a month?
Well, that'd be a lot for migraines.
Yeah.
I meant to say more that they need to be taking the medicine daily in order to prevent the episodic migraine. And the medication we use frequently falls into the category of an anticonvulsant, because anticonvulsants, we know for epilepsy, they stabilize the nerves. And migraine is caused by a brain activity. So you want to stop that activity that is provoking the headache, and that's why a lot of the prophylactic medicines are known as anticonvulsants.
What are some of those medicines? Give me the name of some of them.
Yeah, the medicines that we use, valproate is one. There's one known as Trexamet that is a medicine that we use for headache. And
how about beta blockers?
Beta blockers are still a indication and still a good treatment. The problem is, especially in young women, they feel kind of tired on it. There's been data whether or not it causes some depression. People that like to exercise a lot don't like taking beta blockers, but they still can be a very effective medicine. Some of the antidepressants still can be effective medicine. The calcium channel blockers can be very effective medicines.